Dear Chairman, dear distinct faculty of MFTI, it's my great pleasure to be here, and thank you very much for allowing me to present this work about the stem cell microenvironmental control and to introduce the idea of realizing point-of-care therapies for regenerative medicine in real time. Now, stem cell technology certainly amounts to a puzzle, and I saw this picture at the London railway station, which is not from me. A surgeon can see the whole picture if there isn't one, which means in clinical treatments, decisions need to be made, and the same is also true for stem cells. Stem cells can make a decision. So if I would cut myself here on my left hand, the wound heals in no scar, maybe 4 to 6 days, because the wound is small. If I would burn my hand, the wound would heal, if not treated by skin transplantation, would heal by a scar, and it may take several weeks to heal. Now, why is this the case? Why we, as human beings, do we have this innate limitation? We cannot repair big defects if they are bigger than a critical size. So what is missing to define the in vivo stem cell puzzle? How is healing working in normal human beings, and why can we heal only small defects and not big ones? Now, when we speak about stem cell technologies, many methods have been developed, most of them based on in vitro approaches. And this recent paper in Science shows that if you manipulate cells, introduce genes perhaps, a number of oncogenes may be activated, and almost a large number of human known oncogenes and tumor genes are activated in vitro manipulated pluripotent stem cells, even though it shows in principle that these cells are important and the cells can go to multipotencies. But let me see it from a clinical point of view. Stem cell methods at least require a lot of time to prepare. And if a patient, for example, would have an acute burn, why would you wait 2, 3, or 4 weeks or even 5 weeks to prepare a skin transplant? If it's true that a stem cell has to make a decision, it has to do it within the first hours. Maybe in 72 hours, a skin stem cell may go to fibroblast formation. And the logistics of in vitro work is also very complex, and the cost is high. It is socially not applicable to a large amount of population. Now, why not think about how the body would do this and where the stem cells in our human body are? They are certainly in the bone marrow, they are in the blood, they are in almost every tissue. And just imagine how fast your body can make cells. It just takes about 1 second that your bone marrow will release 1 million cells or 2 million cells. And in cell culture, it would take us weeks to prepare this amount of cells. So our body commands of a much bigger mass of progenitor cells to start with. There are billions of cells available everywhere. Now let me speak about the idea about microenvironmental control of so-called silenced endogenous pluripotent stem cells. So what is this? I believe, and we can prove this, and I shall later show you, especially for the skin and other applications, that we have stem cells everywhere in our body. In the skin, there are CD90 positive cells, they're in the bone marrow, they're in the blood, they're in the bone, the liver, in the cartilage, and the neuronal tissue. These cells are multipotent cells. And what I will show to you is rather a stem cell technology in a conventional meaning. It is not a cell culture method, it is an information technology. An information technology in a sense to try to repair the microenvironment like it is in a small defect, to do it in a big defect. It is an endogenous stem cell activation method. It is an activation, but also re-silencing. So when I would cut myself here, the wound heals by itself and it stops itself. I don't get cancer formation. So our human nature must have evolved mechanisms of stem cell termination, not just activation, what we used to do in cell culture. Now I see it like in a helicopter pilot, for example. It is mission control. If a stem cell that is activated, it has to do a purpose. It must go to commitment, it must go somewhere like you have in a navigation system. So it's communication, information, how cells talk to each other. Now, out of this, a method developed that meanwhile we treated 700 patients in Germany in different fields of application as a point-of-care procedure. The method just takes about 10-15 minutes and is done directly in the operating room as a bedside point-of-care procedure. And it has worked so far in acutely injured and even in chronically degenerated diseases. But one prerequisite is existing. There must be some form of inflammation or trauma. If there's no trauma or no inflammation, it does not work. Now let me show you first the idea about endogenous stem cell activation and go briefly through a few number of clinical applications and then sum it up by speaking about the concept as such a little bit more in detail. Now, when we look into what kind of stem cells we are addressing we find we have in the adipose tissue, for example, but also in the dermal areas of the skin, we have specific types of cells that we would call the CD90 cell. When we published this work, you see in FACS analysis a number of cells. It was believed a few years ago that these cells are fibroblasts, but in reality they are multipotent stem cells that can go to ectoderm, mesoderm, and endoderm differentiation. The CD90 marker is, however, unspecific. It could be also a cancer stem cell. Of course, in the normal skin, the CD90 is a normal type of cell. Now, let me show this work which we started together with Professor Machens, who is the head of plastic surgery at the University of Munich, in a donor site skin transplant, in a skin situation you can see here on the left side. This is a donor site that is a picture is taken at 6 days, and you can see the control site. It was treated by a molecular peptide fragment that comes from cells that would be making this interneighborship to a small injury. It's based on a hematopoietic family. It belongs to the family of erythropoietins. And if this molecule is added to a gel and applied topically to the wound, it activates these local CD90 cells in the wound. And you can see on this side, after 6 days, a split such a donor site graft, which has about 300 micrometer thickness, healed in about 6 days. So it is at least dramatically faster than a normal donor site healing. Now this is a deeper burn, a too deep burn in a second degree burn in a 2.5-year-old girl. And the father at this time, it was a compassionate use case. It was our first child application, refused immediate skin transplantation. We tried to prevent necrectomy, which is normally done after 7 or 10 days. So the child was treated on the 3rd day. After washing the wound, you can see the gel and just a normal dressing was placed upon it. This is 7 days later. This was a little bit dark. Unfortunately, you can see it at about 14 days. You can see new skin came without transplantation. This is half a year, 1 year later. What we find in all these children treated so far, it's only 4 now, the pigmentation comes back and the healing is at least accelerated and necrectomy was not needed. Now, in chronic wounds, 10% of the human population on average have diabetes, and this was a diabetes condition that was a non-healing ulcer treated according to the German guidelines of diabetology at the University of Munich for 3 years and did not heal. It was treated topically 2 times with this local stem cell activation. Then the surgeon put a skin transplant that was previously rejected after he put it after 2 weeks and the wound closed. Now, it's a little bit dark, unfortunately, but you may not see. This is a burned patient that had many scars in the face after 3 years after the burn, and was treated with microneedling, which is a surgical process, medical needling with 3 millimeters deepness to break the scar, which reintroduces trauma. And this topical stem cell activation was applied, and patients report that the inflammation goes away within 24 hours, and this is the result at 6 days later. We showed this to our national authority, which is the National Food and Drug Administration in Germany, showing already in 2009 these mechanisms of localized stem cell activation. You may explain it this way: the CD90 cells are kind of activated and they start to replicate, but do not change the phenotype. If the phenotype is changing, they would become fibroblasts and make a scar. So what we do, we prevent these cells from becoming fibroblasts, and they do not change the phenotype. Now, this is how it works. We put it in the operating room. We developed it's a laminar airflow-based system with a computer-controlled system to allow it to semi-standardize using cells that are prepared in these types of syringes. It takes about 7 minutes from 20 cc of peripheral blood. And then we put these molecules on a matrix or on a gel that can be put on the wound. Let me show you, this was one patient was about to receive upper limb amputation. It's a 55-year-old gentleman of diabetes. You see the bone was exposed. It was untreatable for multi-resistant Staphylococcus aureus infection. The patient was very sick and was totally neuropathic. He could be debrided with no anesthesia. You see, this treatment was started, and the heel regenerates about 13 centimeters from here. Here, the subcutaneous tissue is still missing, but this also comes back, the subcutaneous tissue, and you can see this patient goes from here to an almost anatomically correct shape of the heel, and the foot also is relieved from neuropathy. He had almost normal sensibility diagnosed by a vibration test. This technology as a point-of-care procedure is not only applicable to the skin and wounds, chronic wounds or acute wounds, as it is based on the wound being there in a patient. It could be used also perhaps to make bigger implants like heart valves or airways that we have done, or maybe spinal cord injury that I will briefly show you later. This is a device that may contain a homograft. It could be a heart valve scaffold, or it could be an airway scaffold, it could be a bone graft. It is in a tubular barrack that if it is closed, it is seated in the operating room. So after taking peripheral blood, the cells are coated from the inside and outside, and the sickling molecules, which I will describe you a little bit later, are co-incubated. You see, in our earlier works, it took us about 28 days to prepare these in vitro cell cultures until this mechanism of wound triggering in vivo came about, and the signaling event, which is a co-signal that allows cells to replicate in the presence of trauma cytokines, which are interleukin 6, 1, and TNF in vivo. We have close to the end, yeah, I have to be faster. This is our airway application. We have done spinal cord injury. This is, I will quickly run through this. Patients within 24 hours or 35 hours, they have treated 23 out of 23 cases walked again. In the liver it's the same. The CD90 cell comes up and is activated, but only in these areas we have trauma. The bone, you can see here, can be regenerated in critical size defect. And the same is true for cartilage, you can see in this study. It's unfortunately very dark, and the video doesn't go on. Now let me come up to the empty tendon to see the process. Tendon repair is the same. You can see a chronic ligament injury, acute ligament injury can be repaired. So the scientific concept. We fix large defects like small defects, and the stem cells are CD90 cells that are activated, and it's a time-dependent process. So basically, the idea is to create a situation in a microenvironment that replicates a small injury situation in a large injury situation, and these cells are activated. This is the basic concept. We activate the cells, so we use peripheral blood. We activate these co-signals. We use commitment signals. In the large defects, materials have to be added to replicate. And this is the concept. Of course, there are different protocols, different microenvironments. And coming up to the end, we use standardized devices in bioreactors that introduce a semi-automation to have the idea of pharmaceutical manufacturing in a clinical environment. Now, these fields of innovation, one of them is the scientific idea of activating the silenced endogenous progenitor cells in the areas. The other one is a point-of-care idea of manufacturing in the operating room, which takes an average 10 to 15 minutes. There's the acknowledgement of the work and the equine work and the small animal work we did in the basic research team of my group. So I'm sorry I had to rush so much, but thank you very much for your attention. Thank you.